Hey guys, it's Robin. So I have no workout for you today. I hope you're not disappointed, but I wanted to address another issue that I think is a big issue. And I know I've struggled with it. It's been a problem for me, and it's also, I've had a few people coming up and asking me about it lately, and I've had lots of people in the past as well. So I thought maybe I just better, do a video, show what I do and what works for me, and maybe it will help you too. So my name's Robin, and I really love fitness, and I'm really on a health and fitness journey. I've come a long way from where I was when my kids were really little and I was suffering from postpartum depression. That's how I got into exercise, because I had heard that could really help me with the depression. I'd read that actually. I'd done a lot of research, and it really did start to slowly help and make me feel better. And that was sort of the start of this journey I've been on. And it's progressed to clean eating. I had a lot of joint pain, and cleaning up my diet and really focusing on anti-inflammatory foods and avoiding foods that were bothering me. And it was a whole process to figure that out. But now I don't really have any joint pain, so it's pretty awesome. But one other thing that I've struggled with is, you see my posture is not the best. Like, I tend to have rounded shoulders. And so I've always had problems with tight trapezius muscles, even like as a kid. And so it wasn't until I was sort of an adult where it started to really affect me more and more and more. Because we can go a long time with our bodies are pretty resilient, and they're pretty good at finding another way to function. And so they'll just keep going until you kind of get to the point where it just can't compensate anymore. So what I'm talking about today is tight trapezius muscles. And I've had a few people say, oh, my neck and my shoulders are just so tight. And it can happen because of posture. It can happen because if you start working out, those muscles, might be getting a little bit overused or used more than they're used to. And they just get tight. They just contract and they won't let go. So I have 4 tips for you on how to do that. First, I'm going to tell you, I guess, a little bit about the trapezius muscle. There's 3 parts to it: the upper, middle, and lower. And the upper starts up at the base of the skull, basically, the very top vertebrae, and it comes around to the back of the clavicle, and that's where it attaches. So this muscle here that you can see, that's your upper trapezius muscle. The next muscle kind of starts over here on these vertebrae and comes across the tip of the shoulder and a little bit of the scapula, and then the lower trapezius comes from these vertebrae here and comes across also to the shoulder scapula area. So it's a big muscle that covers a lot of area, and it can be tight in any of those. Upper traps is kind of typical, but it can be your middle or lower traps as well. So first thing you want to do is pay attention to what you're doing throughout the day. So say I'm on my phone. I was going to grab my phone, but it's there. So if you're on your phone, are you like this? Are you hunched up? Your shoulders are up? Because that's going to cause these muscles to kind of get overworked and get tight. And so just, take a time during the day to notice. I have to do this a lot. Notice where your shoulders are at. And if you're cold or you're tense or you're stressed, that is what tends to happen, is your shoulders start to come up towards your ears. And anytime you're doing exercise as well, like if you're working out, you want to really make sure your shoulder blades are pulled back and down, and that your shoulders are not up when you're doing an exercise, because that's really going to affect what you're doing. Okay, so that's the first thing. So just make sure that your shoulders aren't up during the day. Check in regularly, like maybe set a timer every hour, and then just go, yeah, okay, where are my shoulders at? Just relax them, because it's partially habit that we don't even notice. The second thing that you're gonna do is just do shoulder shrugs. So if you're feeling like you have some tightness in here, just lift your shoulders up and hold them there for a couple seconds, and then drop them down. And that's gonna help relax those muscles. The other thing you can do is shoulder rolls, forwards and back. And that's gonna help relax those muscles too. So if you're sitting at a computer, you should probably stop and do that, every half an hour at the most. Just move those muscles around so that you're not in a tight static position, because it does lead to a lot of problems. Now the third thing we're going to do is stretch. So this is really important as well. First stretch is just going to be chin to your chest, and you're going to hold it there for about 10 to 15 seconds. So do it right now. Let's hold it. 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, And then the second stretch we're going to do is a side stretch. So we're stretching this muscle here. So this shoulder needs to be down, not elevated, okay? And have your head to the side. And really you're going to feel a nice stretch there. If you don't feel too much of a stretch, you can gently just use a little pressure on your head to increase that stretch. I don't really need to because this is pretty tight. Okay, and then the third stretch we're going to do is a diagonal stretch. So it's basically like you're going to be putting your nose to your armpit. Again, this shoulder is going to stay down because we're stretching out this muscle back here. And it actually feels really good. Okay, now let's do the other side. So we're going to start again with that chin to chest stretch. And now this shoulder is going to stay down and we're going to tilt our head to the side, again stretching this muscle. You can see how tight it is on me. It's really tight. I really need to do these stretches. I did yoga yesterday and part of it was neck stretches and it felt really good. So I know it makes a difference, but I'm like everybody else. Sometimes it's hard to fit stuff in. And if it's not a habit and if it's not part of a routine, it's hard to do. That's why I'm saying set a timer throughout the day, and at least once an hour you just take a quick break and do these stretches, move around a little bit. You shouldn't be sitting statically at your desk for hours on end anyway. It's just really not the way our bodies are meant to move, and you're gonna end up with problems. Okay, that feels really good. Now the last thing that you can do is, I have my lacrosse ball. You can use a tennis ball or whatever, or just your fingers, but I do find a ball easier. And you can just put it on the muscle that's tight and just kind of push, move it around. It's kind of like your own personal massage. Going for a massage is great. I do that monthly because I find it really makes a difference. It's kind of an important maintenance thing for me. And I've been doing that since I was pregnant with my third, so probably like 10 years. And so if you find a spot that's sore, that's what you're looking for, a sore spot, because that means it's really tight there. You're just gonna settle on it and just push. And because you might be feeling some soreness in your lower traps or your middle traps between your shoulder blade and your spine, that's another really common place that people are feeling pain. And this works really well for that. You're gonna take the ball and you're gonna put it kind of over where you're feeling sore, and then you're going to push up against a wall. This works great. And then you're going to move around, just roll around a little bit until you feel a nice sore spot. Oh yeah. And then you're going to settle there until you, hopefully you start to feel that area relax a little bit. And then you're just going to move a little bit, and then you're going to feel it relax. Hopefully, that's the goal. If it's really tight, it might take some time, but guaranteed it's going to feel better. Okay, and I'm going to go up. Oh yeah, and right up onto probably my middle traps. Oh yeah, that's really tight. So you can do that for as long as you want, but it works really well. Hey Sybil! Yeah, your lower traps get you. Yeah, and I've been to physio, I've been through all of that, and I go for massages regularly, and it's a process. But if you do these things, when you start to feel tightness, hopefully you can prevent what some of us have gone through. And I do have to do it regularly, and you can get headaches, especially from your upper traps, because it extends right up here into the top of your neck. And I do get that if I'm not careful and I don't pay enough attention. But now I know what to do to relieve that. So I think that's really important. So I hope you guys find that useful. And comment if you have issues with your traps or if you're going to try this out. And let me know how it goes. And I have a few people that I'm going to tag in this because you've been talking to me about your issues. So have a great day. I hope you guys all have an awesome day. Oh, Sybil, you got finger and elbow pain with yours too. Interesting. Yeah, mine didn't go that far. Mine was more headaches, unfortunately. Okay, you have a great day, and I will talk to you soon. Yes, foam roll. Go foam roll. Foam rolling is so important. We don't take enough time. Like, none of us take enough time to actually take care of ourselves, so we need to do that. So go take care of yourselves and have a great day.